Hello, everybody, and welcome to our first live chat. I'm one of the trustees with the Pearl of Africa Childcare, and I know that so many of you have been asking us how things are in Uganda and how everybody is at the foundation, how everyone is at the schools. And so we are so excited that we've actually been able to connect with Auntie Molly and Uncle Paul. As you can see, they are both here today. Thank you so much for joining us, Auntie Molly and Uncle Paul.
Thank you very much. We are happy.
You're welcome.
So for those of you who have never seen the choir perform, or you've never been in the UK, or you maybe aren't even watching us from the UK, Auntie Molly and Uncle Paul founded the Molly and Paul Childcare Foundation in Uganda 40? How many years ago? Can you remember?
Over 35 years.
35 years ago. And since they founded the foundation, they have literally provided education, a place to call home, and really a lifeline to thousands of children in Uganda who, without the foundation, would never have been able to go to school, potentially go to university, basically learn the skills and things that they need in adulthood and ultimately to thrive as young adults and contribute back to Ugandan society and help it create this rich culture that it is today. So Auntie Molly and Uncle Paul are joining us from Kampala, I believe. Is that right?
Yeah, Uganda, the part of Africa.
Yes. And Uganda has been on lockdown quite similar to England due to COVID since around March 26. And unfortunately, all the schools did close so that all the children could go back. Maybe you could tell us how are things in Uganda at the moment? How are the schools and the teachers and the pupils? How is...
Well, thank you, Becky. It's a pleasure for us to be able to speak to you, our dear trustees of the Power of Africa Childcare UK. Thank you very much for your support. And we're here in Uganda, Kampala. Uganda is called the Power of Africa. It was renamed by the famous British Prime Minister Churchill. So we are Winston Churchill. Now, on the 19th March this year, the government of Uganda closed all the schools in Uganda and universities, totaling to 15 million pupils and students. So ever since, we've been locked down or at home. That has been a very difficult time, as Molly will also tell you later. Transport was curtailed. You could not travel. There was no transport, and feeding became a problem. Our teachers and the staff were scattered, and some were still at the school, and some children
are still
in orphanage. Yes, and
we have really faced some problems because. Like feeding some of the children who stayed at school, it was very challenging because we didn't have enough, even up to now. Yeah, the mamas are trying to grow some food, so we are being helped a little bit, but some essentials we can't get them. For the staff and for the children, because as you know, the man which is normally sent to Uganda, this time it was in a little bit lower percentage because it has to take us even next year. So we could not have enough for whatever we had to do. As Awisha explained, like that drugs, the medical requirements and other things, feeding and caring, and even like the schools, they say we are about to have the candidates, like primary service.
The government, the Minister of Education has come up with a program to make sure that candidates in the final year in primary, that's primary 7, and the senior 4, and the senior 6. So these people are starting next month only 1 class. But the problem is huge, because when you start 1 class, all the expenses are the same.
With the whole school.
Because you need all the teachers to come just to teach 1 class.
Yeah.
And you need the cooks, the security men, or the mothers, or every member of staff will have to come only to cater for 1 class. And that's a big, I don't know how we shall manage, how we shall cope up. Feeding is a big problem. As if that was not enough, Uganda has been experienced a lot of rain, floods. So food production has been partially affected. These are such problems that people are encountering in Uganda.
Yeah.
Another thing, when we were leaving the schools, we had a program of e-learning. We asked our teachers, wherever they are, to start setting and sending lessons to our students. But the problem, some students don't have TVs, radios, and
mobile phones.
So such is the situation in Uganda.
I also heard as well, and I know that with the children coming back to school, even those grades that have been told, that the government are talking similar to the UK about there being a lot of restrictions that potentially is going to cost money to be able to, even with the smaller classes, be able to bring those classes back.
Exactly.
Now, like there are things which we think should have been in place before even the few classes come back. We need to have that testing, whatever, I don't know.
Shooting the guns? Are they called guns?
Thermometers.
Thermometers.
Yeah.
The children who are back and the staff members who is okay and who is not okay.
Yeah.
Another challenge is that the sitting arrangement, because we have to do social distancing, which means we shall need even more teachers than we have ever needed for just 1 class.
More desks, more laptops.
More desks, more everything.
Yeah.
Like each class might have like 16 or 17 students, and it's like the whole school is going to occupy 1 class. That is also another challenge. And also, like, how are they going to sleep in the
dormitories? Yes.
In the dormitory, how are we going to space them? And during break time, during lunch. So we still have lots of questions as to how we are going to keep healthy everybody, all the children, the staff at school.
And in our schools, we don't have enough teachers teaching, staying permanently as staff members. So we've got half of the teachers are on part-time basis.
Yeah.
So they come on different days. But again, transport is a problem. And we are not sure if these people who are staying outside will come okay, will not bring any diseases or take diseases from the school. So,
right. Yeah.
So it's scaring, kind of. Yeah.